think now we've got the door shut, we'll get started. Yeah? Okay. So thank you, everybody, for coming along. Sandra and I are going to be talking about safer vegan pregnancy and children's health. And the talk today, like the rest of the talks on this side, are all designed for health professionals. This is the first year that VegFest has run a health summit, and hopefully this will continue every year, where we're trying to encourage people from the health professions to come in and to hear all sorts of different health professionals speak and give a qualified opinion on the area that they're talking about. And that doesn't mean that you have to be a health professional to sit in this room. Everybody is welcome. It's just that some of the slides you might think, well, they've not given us very much detail on that, and that's because our talk is designed for the health professional. So, do you want to?
Thank you. Well, my name is Sandra Hood. Excuse my voice, I'm just recovering from a bit of a cold. I'm an NHS dietitian, and this afternoon, the two of us are hoping to raise the awareness about managing nutrition for all life. All lifestyle of all ages. And just to say a little bit about myself, I've written the book Feeding Your Vegan Infant. I'm also a nutrition advisor to the Vegan Society, and I'm committee member of the Plant-Based Nutrition Group, which is affiliated to the British Dietetic Association Specialist Group.
Thank you, Sandra. I'm Yvonne Bishop-Weston. I've spoken at a lot of VegFest before, so if I have seen some faces before, hello again. I'm a nutritional therapist, so Sandra and I are working very differently, doing the same thing, just working from different directions. I have a nutrition company called Foods for Life, and I have clinics in London and Hampshire. I also do quite a lot of media work, trying to talk to people through the press about healthy eating, and I co-author cookbooks, plant-based cookbooks. Am I doing the agenda? Yeah, I am doing the agenda, sorry. So today we're going to talk through working together. So how the different health professionals really need to work together to get the best outcomes for the people that we're working with when it comes to diet and food and nutrition. We're going to talk about understanding your patient. So whether you're a health professional or you're a patient, whether you're the person on the other side of the table, we're going to be talking about that relationship and how we can better manage that relationship. We're going to be talking about best practice, vegan nutrition fulfillment. So we're going to be talking about where the evidence is. We're not going to go through every piece of evidence, but how much evidence there is on the plant-based diet. And then we're going to sort of focus a little bit more in depth on pregnancy, because it's such an important time. And it's a time when even if you are following a plant-based diet and you feel really comfortable with yourself as an adult making that decision, when it comes to the next generation, it can feel quite nerve-wracking. And we're going to be talking about whether the plant-based diet can achieve the Nhs Guidelines, whether it is a safe diet and a healthful diet. We're then going to just really then talk about growing up. So we're going to take another little snapshot of children's health, and then I think we've just been given a clock, we have, and then we're going to have question time, and we're happy to take questions at any point, and if that means that we don't get through every slide, that's absolutely fine. And so why are we here? We work with people clinically. We work with people in our clinics, me privately and Sandra within the NHS. And we work with people on plant-based diets as well as people who are not on plant-based diets. And we're here to share our different knowledges on this subject. We're here to talk about evidence-based balanced nutrition advice. And we're here to talk about the specifics of vegan diets, because that is an area that both of us have a higher knowledge base than maybe some, because we have worked in that area more than some. We're also going to discuss about how we can better meet our patients' needs. And as I say, it can be a difficult time when you're pregnant and you're considering, do you bring your child up plant-based? And you can be faced with all sorts of comment from different people. So we're going to be talking about that. We're hoping the outcome for today, for both of us, what we'd like to achieve is the understanding that actually if we understand a bit more about plant-based diets, then we will be in a better position to feel confident in them as practitioners ourselves, and to be able to work with people, and to allow people to work with us as well, and not to be afraid that they're going to be judged when they come to us. And I'd like to start with a case. We were sat down about a month ago saying, right, what are we going to talk about? What should we do? What do we think is the most important? And as we were talking, I mentioned to Sandra about a child that had come into my clinic just a couple of days before, a 3-year-old little boy who wasn't gaining weight. The parents were living a plant-based life. They were bringing up their child on a vegan diet. They'd researched it. They took this decision very seriously, but they were worried their child wasn't gaining weight very well, so they went to their GP. Their GP agreed that something was needing to be done here and referred them on to a dietitian. The dietitian said that the vegan diet wasn't appropriate. The reason that this child was underweight was because the vegan diet couldn't fulfill. And they brought in all the information that they were given, and they were given information on what to feed the child, which recommended things like fish paste and meat paste. Did anyone know you could still get those in a jar in the supermarket? I remember my granny having them, but I didn't know you could still buy them, but you can. They recommended things like chicken nuggets, which children would gladly eat and which are quite high in fat, and ice cream and things like this. And I looked at this and I thought, okay, there must be a reason for this. So I looked through, I analysed the diet, I looked at in-depth food diaries, what the parents were preparing for their children, and it was a great diet. It had all the nutrients in there. It was a really well thought through, balanced diet, yet this child was underweight. And to be honest, I made a few tweaks, but if any of you went and looked at my food diary for the last 3 days, probably today especially, I'm sure all of you could make a few tweaks to my food diary. And it wasn't the food. There was absolutely nothing wrong with the food. So we looked, part of one of my clinics is a neurodevelopmental clinic for children who are developing differently from a neuro point of view. And we looked at this in more depth, and the child appeared to have sensory issues. It was not the food. He wasn't eating the food. There was something different about the way that he perceived taste and flavour and texture, and there was nothing wrong with what was being done. It was that this child was developing differently to other children. So we referred on to speech and language and occupational therapy, who will be investigating, because in actual fact, it appears there are some other developmental problems with this child as well. And that needs looking into for this little boy to have the best outcome he can personally have. And what I'd like everybody to just think about themselves, if this family had not gone to the GP as a vegan family, would the GP have thought, something a little bit wrong here. Let's look at what's up with this child. Let's refer to SLT. Let's refer to OT. Let's start with paediatrics. Would that have happened? Or was the GP making a judgment there, and then was the dietitian making a judgment there? Even more importantly, because the GP did refer on, was the dietitian making a judgment that it must be the vegan diet that was wrong? And if we look at the very beginning of health and medicine and how we look after other people, the very original Hippocratic Oath said, I will devise an order for them the best diet according to my judgment and means, and I will take care that they suffer no hurt and damage. From the very beginning of health profession, there has been diet in there. The way we eat is fundamental to making our patients well, and also about the fact that we need to respect the way they live. And then if we look at the latest update, 2013, we must treat patients fairly with respect whatever their life choices and beliefs, including political, religious and moral beliefs. And are we doing that? Are we really able to look at the science behind the vegan diet, or are we making judgments? And just in terms of understanding our patients, why are people vegan? And there are so many different versions of this. There are so many different reports that will tell us slightly different stats, but if you look at them as a whole, they say roughly the same thing. About 57% in this particular survey of people chose to be vegan or plant-based, however you like to phrase it, because of concern of treatment about animals. We might call it moral, we might call it ethical, we might call it belief systems, whatever we call it, it was about the animals. 15% for health reasons. Now, these were primary reasons, so an awful lot of people, where you look into it further, are choosing animals first, but actually health is a really, really important second decision, especially when we're making that choice for our children. And then 15% for environmental reasons, and over the next 2 days, there are talks on everything, and there are some brilliant talks going on about the environmental impact. And how many of you have decided you're going to use less plastic bags? Is that all? Or maybe you're just a bit shy with your hands. We've got a boot full of nice cloth bags. We get into the supermarket, we get to the till, and somebody says to somebody else in our family, did you bring the bags? No. Did you bring the bags? No, they're in the car park. And then we can't hold up the whole queue and we use plastic. We're trying really hard again because we've been prompted, we've been reminded to not use plastic bags. We've got to stop doing it. But actually, if you look at the impact, somebody that's speaking today, in fact, put it on Facebook just a couple of days ago, the impact of not using plastic bags compared to the impact of taking meat and dairy out of your diets environmentally just one day a week doesn't even compare. It is a huge environmental load eating meat and dairy products. And by that way, I'm not saying don't go for the non-plastic bags. Please do continue with the non-plastic bags. And the rest of people didn't like the taste, social pressure, all sorts of other small reasons. So is it best practice to treat every individual patient with respect for their beliefs? But what we're going to explore today is actually, it's more than that. It's actually best practice in terms of being a health professional and trying to get the best health outcome to look at the plant-based diet, because there is so much evidence on why the plant-based diet fulfills the health criteria that the government and the NHS set down for us, but it also exceeds that in many other areas. And we can't go through every study and you'd all be asleep. It would be terribly boring, but we're going to give you a snapshot of where the evidence lies. And if we just look at the Nhs Guidelines, the 5 a day, and by the way, there's pages and pages and pages of references at the end of this for anybody that wants a particular reference to anything. There's a meta-study that showed, we know this, we know the 5 a day is based on how much the government think we can achieve rather than what is actually needed from a health point of view. It's more like 8 portions a day that are needed. But there's more chance of that on a plant-based diet, where a lot of the diet is basically fruit and veg and beans, which comes under the 5 a day. The government advises that we cut red and processed meats down to a maximum of 70 grams a day. We choose vegetarian options and we have meat-free days. That's not too hard to do on a plant-based diet. That we cut down on saturated fat. Of course, that's not too hard to do on a plant-based diet without the meat and dairy. That's something that naturally happens. That we cut down on sugary, salty, and processed foods. Now, you can be a junk food vegan just as much as you can be a junk food omnivore. There is no reason that says because you are vegan that you are following a good and healthy diet. However, within the structure of the diet, it is much easier. And if you go into any newsagents and you have a look at the range of chocolate and sweets and confectionery that is available to our kids as they go into shops, and then you pick out which ones of those are vegan, you're going to be left with a handful. So naturally, we do actually cut down on the junk out there because we don't have quite as much availability, which is quite helpful. Choosing whole grain varieties, sorry, I keep eating my microphone because I'm so determined you can hear it at the back. Choosing whole grain varieties of cereals, pastas, rice and bread, that applies to all of us. And eating more fish. Eating more fish doesn't really work when we're talking about pregnancy, when we're talking about fertility and pregnancy planning, when we're talking about children, because of course we have to be very limited in how much fish we eat because of the mercury, the dioxins, the PCBs, the things that can cause harm to developing babies and young children, can cause harm to all of us, but we have to be particularly careful before all the detoxification systems are, and the digestive system is all fully in place. So we know that we need the omega-3 fatty acids, but we can't rely on them from fish, and vegans can eat nuts and seeds, which will be processed within the body to these fatty acids. And for those that have a higher need, we now have beautiful formulations, which we didn't have when my youngest was little. We just didn't have those in such good formulations. We now have beautiful algae-based versions of EPA and DHA, which is the fish oil equivalent, but without the need for purification, without the need for taking all of the stuff out that we don't want in there. And we do need to look at our diets. We do need to learn from our mistakes, because we've made some huge mistakes in our dietary advice and our dietary practices. And called, the Americans get the blame, called the SAD diet, the standard American diet, or the Western dietary pattern, if we don't want to sound like we're being rude to the Americans. But it's basically a diet of too much saturated fat, too much processed food, too much sugar, too much salt, and not enough of the good stuff. And what are the consequences of this being a normal diet? I mean, we're a little bit away from the Olympics, but look at the sponsorship in the Olympics, where we had fast food being a restaurant sponsoring our Olympics. What are the implications for our children of this being our normal, accepted, everyday diet? The consequences are that they're going to suffer diseases that have a preventable section to them. Not totally preventable, they have a preventable core. They may well be underachieving at school. The way their brains work may not be as ideal as they could. And of course, they could be facing a world of environmental catastrophes because we can't continue the way we are in terms of our meat and dairy production. And to look at some depressing stats very briefly, a fifth of reception and a third of year 6 children are overweight or obese. Research has found overweight 5 to 15-year-olds have raised blood pressure, cholesterol, blood sugar, and a thickening of heart muscle that we would expect in old people, in children from 5 years of age. And a quarter of 5 to 10-year-olds in America are showing heart disease early warning signs. That is ridiculous. That's unnecessary. That should not be happening. And children as young as 7 are being diagnosed with age onset, mature onset, type 2 diabetes. And that means that it could actually mean that they lose their sight or they need to have an amputation in their 30s or 40s because this age-considered disease is happening so young because of their diets. And 25% of 15 to 18-year-old girls are iron deficient. Their brains aren't going to work as properly. Nothing's going to work as properly if they're going to be iron deficient. And diet is not the only factor. We're not saying that we can cure the world of getting people to eat properly, but diet is a key factor in these diseases. And we have grown to accept preventable disease. The preventable disease epidemic is something that we think is normal. We think this is an ordinary thing. And again, that's something that I would urge you to stop and reconsider. Do we want this to be normal? Most of us know somebody with diabetes, with heart problems, with obesity, with weight issue. This is considered to just be part of living and aging and being human. We have developed a culture of handing over responsibility. It's my doctor's job to get me well. It's my doctor's job to sort this out. It's our job to be well. It's our job to be healthy. But the other side of that coin is it is our health professionals' job to support us in that journey. It's considered to be quite ordinary and normal to have open heart surgery, to go in to the body and do significantly dangerous things to our internal organs and then put us back together. Yet you go in and you tell people that you're going to follow a vegan diet, and you're thought of as to be a bit odd, a bit extreme, a bit mad. That's okay, but if you decide that you're going to inflict that upon your children, then we will start to get a little bit worried. Well, we don't get a bit worried, but people can get a little bit worried. So we need to learn from the mistakes we've made, and we need to move forward, and we need to do better. And I'm going to hand over to Sandra, who has done all of the trawling through of the research and put together the science and all of the information. And she's just going to give you some snapshots and some key points as to just to show you that we now have all of this evidence on the benefits of the plant-based diet.
Thanks, Yvonne. Can people hear me okay? So excuse me again for my croaky voice. First thing I'd like to say is the vegan diet is about inclusion rather than exclusion. So I think once people think about the plant-based diet, it opens up the world to lots of other foods that people on a conventional diet wouldn't even consider. And my experience as a health professional is when I have seen parents who are plant-based, following a plant-based diet, they have a lot more knowledge than the parents who follow an omnivorous diet, which is really interesting. So, as we've written here, the plant-based diet is rich in fruits and vegetables, nuts and whole grains, naturally low in saturated fat, and can help reduce your risk of lots of the chronic Western diseases. And the plant-based diet more closely matches the recommendations of the Department of Health. It can manage your total and bad cholesterol, help to reduce blood pressures, and it's so good to benefit against heart disease. So as I said, the vegan diet, the plant-based diet is about inclusion rather than exclusion. And when you naturally turn to a plant-based diet, you automatically increase many of the micro and macronutrients. So plant foods are naturally rich in iron, all those vitamins and minerals, and particularly rich in vitamin C. The plant-based diets are rich in the folates. Vitamin D is a nutrient that everyone should be concerned about, with being covered up more from concern about not getting sunburn. But certainly vitamin D is something that's lacking in most people's diet, whether you're vegan or omnivorous. And for children, vitamin D drops are recommended up to age 5 years, and for adults over 50 years of age, vitamin D is recommended. So with regard to vitamin B12, this is the main nutrient that somebody on a plant-based diet needs to make sure they have in their diet. Years ago, we would naturally get it from contaminated foods. The reason why non-vegans get that vitamin is because they eat animals, and that B12 is in the gut of the animals. So obviously, plant-based diets need to get that vitamin B12 from another source. There are some fortified foods that you can get the B12 from, otherwise to take a supplement. Calcium, again, is an essential mineral for bone health. But again, calcium, the dairy industry got on board many years ago with providing all the nutrition information for nutritionists. So because it was the dairy industry providing all that information, then that's where dairy has got this high profile. But when you think about calcium, it comes again from plant foods. Years ago, as hunter-gatherers, we get it all from our green leafy vegetables. And think about all the large boned animals. They're vegetarians, and they get that from the plants they're eating. But that doesn't mean we need to not be concerned about calcium. You still need to make sure you get adequate calcium-rich foods. And there's an abundance of calcium-rich foods in a plant-based diet. The omega-3 fatty acids, we're not going to go into that in a lot of detail. There is somebody else giving a talk. Christine Bailey, I think. Christine Bailey is going to give a talk about the fatty acids. But again, to remember, essential fats are from plants. They're the essential fats. So these essential fats make some other fats, which your body can make, and some people get these directly from animal foods, but they essentially come from plants. Iodine, again, this is something that comes from plants. Protein is in everything, nearly everything you eat. Protein is very important for growing children, which we'll talk about in a bit. But again, you can get adequate protein from a diet containing adequate calories. So vegan pregnancy is very important, and when vegans become pregnant, they often get quite anxious about this because they're in the minority, and the majority of health providers aren't aware of what's necessary for a vegan diet. But again, a vegan diet can provide all the nutrients needed for a healthy pregnancy. But we're going to go through some of those important nutrients because obviously it can be of concern to people. So with regard to looking at the Nhs Guidelines, we've just put together here those nutrients and where you can get those nutrients from. And again, it's clear to see straight away you can get adequate vitamins and minerals from a plant-based diet. So we've just listed some of those sources. And as Yvonne said, there's lots of references towards the end, so you can get all the details from those. And with the pregnancy risk, this is quite a very interesting slide. When Yvonne and I see patients who are pregnant, whether they're omnivores or on a plant-based diet, straight away you can see the concerns with an omnivorous diet. So the foods that we tell these patients to avoid are the animal foods, with the only exception being to that really is with regard to soil, which could be on some of the fruits and vegetables you're eating. So you can see straight away it's a raw or partly cooked eggs, which is advised to be excluded from the diet. Some of the cheeses, the fish oil supplements, again, that Yvonne mentioned about also the PCBs and also the toxins from those. With peanuts, there's been a lot of research lately that's shown the more variety of foods you can give to children when they're growing, the better it is for them. Unless there's known allergens in the family, it's best to give those children all the foods, all the variety of foods to reduce the risk of allergens later in life. So peanuts, for a pregnant woman, absolutely fine. Caffeine, again, we know about the risk of caffeine for all groups of people, whether you're pregnant or not. Again, dairy, you need to be careful with that. We've mentioned about the soil. Again, things like undercooked foods, the pâtés. Again, you need to be careful. Undercooked meats, then things like liver, cured meats. So as you can see, the table there, it all highlights those omnivorous foods, animal foods. So what we'd like to highlight is the vegan diet can nutritionally provide all the right nutrients for all stages of life, right through from preconception through the elderly years. So for pregnancy, breastfeeding, all the way through for all ages until a later life. And interestingly, I've been working in the NHS, not a long time now, for about 18 years. In those 18 years, I've had 2 patients on a non-animal diet referred to me. One was 100, he was a vegan, in hospital. He was on the ward and they were concerned about what foods he could eat, and he was 100, that's a couple of years ago. And the other one was a vegetarian who was eating too much dairy and he had a high cholesterol. And there are very few vegans and vegetarians, fortunately, that are referred to me in my years working for the NHS. That doesn't mean we don't need to look after ourselves, we still should. And the considerations we need to have for children are obviously very important. During those early years, the nutrients are so important to make sure we get a good balance. But everybody should be thinking about what they're feeding their children, whether they're following an omnivorous diet or a plant-based diet. But as I said, I think often vegetarian and vegan parents give a lot more thought to that. So in a minute, Yvonne's going to go through some of those groups of foods, the proteins, talk about fats, a little bit about calories, where we can get our nutrition from with the starchy carbohydrates, talk a little bit about fibre, and also about the calcium-rich foods again, which often comes back time and time again that people are concerned about. But I think the main reason for that is from the years and years of the dairy industry funding the nutrition advice for health professionals.
So I'm not going to go through everything about protein, what protein does, why we need it. I'm just going to pick through... Was that me? I'm just going to pick through some of the points that we need to take additional consideration for when we're talking about plant-based diets for children. As we know, protein is made up of amino acids, and those amino acids we will need a greater range the younger that we are. From the very beginning of life, we have more of the amino acids which are essential, and by essential in nutrition we mean we cannot make them in our own body. And if we can't make them in our own body, there is only one place we're going to get them from, and that is the diet. As we get older, we knock a few off and they become less essential, which means we can produce them out of other amino acids. Now, some proteins are full of all of these amino acids, and so they are considered to be complete. And that includes all of the animal foods, but it also includes an awful lot of other foods: soya, hemp, quinoa, amaranth, buckwheat. I'm sure I've forgotten a few that somebody will probably point out to me. But there are plenty of foods which have all the essential amino acids within them. But even if we eat foods that don't have the essential amino acids, our bodies will combine these amino acids. And there's a complicated table down on the bottom here which tells you how you do that. But all we need to do really is think about when we're feeding our children and ourselves, our health matters too, is that we have a grain and a pulse and ideally a seed. And once you put a grain, a pulse and a seed together, you can't go wrong. You're going to get all of the essential amino acids, and your body's going to be able to produce the proteins needed for the immune system, for mood, for the nervous system, for growing bodies, and for balancing blood sugar levels and helping us to have steady energy throughout the day is also an important part of protein. Not amino acids in particular, but protein. So in terms of where we get these natural combinations, if you go to the Caribbean, you might have rice and peas. If you go to Mexico, you might have a tortilla and refried beans. Anybody know what we traditionally feed our children in this country, which is the perfect protein combination? Beans on toast, thank you. Yeah, absolutely. So all of those people are unsuspectingly feeding their children perfectly balanced plant-based diets when they give them beans on toast. And so what would a day's protein look like for a child? Now, obviously, child goes from young to quite old, so this is quite tricky. We're talking sort of a 2 to 5 year old here to have just picked a category. So at least 1 to 2 portions of beans a day. The Americans are going to put beans on the vital to eat every day chart because beans are something which we shouldn't just have every now and then when we have a bit of hummus. Beans are something that should be a fundamental part of the diet for all of us on a daily basis. A portion of nuts or seeds a day, and the younger they are, not only do you need to grind these up to stop them choking, but also because it's a lot easier to chew. Nuts and seeds can be quite tricky for little people, and also we don't break them down so well in the immature digestive system, so grinding nuts and seeds will increase nutrient absorption. Giving protein at every meal and at least one snack a day, just for slow release energy and just a more pleasant child to be with, as well as better learning and concentration and things like that. And just as in the omnivorous diet, processed meat replacements can be used, but watch out for high salt levels in particular, and watch out for additives. Now, you will struggle to find many these days, you will struggle to find many meat alternatives that will match the hot dogs of the omnivorous diet world. And there are some quite frightening studies that have shown the risk of dying increased. The risk of diabetes comes up to nearly 50% if you have daily bacon or hot dogs. So we're going to struggle to find that in the processed foods, but really we want to be teaching our children to have a diet rich in beans and pulses and nuts and seeds and fruits and vegetables, rather than relying just on the processed meat alternatives. And the benefits: less saturated fat, because a lot of the saturated fat on animal proteins, a lot of the protein in animal proteins comes attached to saturated fat. Less availability of hydrogenated fats, because the plant-based diet is adopted by many people not full-time, but in bits, because they're choosing products which are plant-based instead of meat as an alternative for part of their week, because they're considered healthier. What's actually happened is a lot of the vegan products have become much healthier. So we struggle to find really poor quality ones these days. Fats are fundamental when we're producing babies. They grow the nervous system, they grow the retina of the eye, they build the structure of the brain, and it is really important that we get the right fatty acids when we're pregnant and when we're feeding children, especially up until the age of 5. But fats are also important for another reason. Fats are incredibly calorific. They carry twice as many calories as protein and carbohydrates. And if you think about the size of, I'm not going to read out all of these age, but it's surprising how many calories little people need if you look at the size of their stomach and how much food they can physically take in when they are small, and then how much calorie output they have because they're growing. We don't need as many calories to maintain our bodies unless we want to keep growing outwards, but we're not going to grow upwards once we're an adult. And also, not only are they growing, but they're usually more physically active. So it is important that children's diets are fat-rich. And if you look in pretty much any children's cookbook on how to feed children, what is the key ingredient in virtually every recipe? Sugar. Yeah, actually, we've got a little bit better in children's cookbooks, but you're right. Cheese. Cheese is considered to be a fundamental part of almost every meal when you're looking at feeding children. And the reason for that isn't about the calcium, as Sandra was saying. The reason for that is about the fat. But it isn't necessary. Without cheese, it isn't necessary to do that. All we simply need to do is make sure that the plant-based children have enough calories from fat in their diet. And we can then choose good calories, lower in saturated fat. We can choose avocados, we can choose nuts, we can choose seeds, we can choose high-quality oils. There are all sorts of places where healthy fats come from. And if we look at cheese, the American Heart Association recommends that 2 to 5 years, no more than 5 grams of saturated fats for children. And we were discussing this because Sandra thought this must have been the most ridiculous cheese sandwich in the world when I put this slide in. But in actual fact, we went to M&S and we went to Motorway Services and we looked at cheese sandwiches. And admittedly, we picked the biggest, fattest cheese sandwich we could find. But both of those were consistent. There was 16 grams of saturated fat in a cheese sandwich for an adult, not a child, but lots of children will eat a full-size cheese sandwich, and they can't have more than 5 grams in a whole day. Now, I would hope that any child that's eaten a cheese sandwich for lunch, that's not going to be the only food they're going to have all day. So a day's fat for children include a daily portion of essential fatty acids. Again, essential means they have to come from the diet. We cannot make them, and they are fundamental to health. Every single cell membrane in the body is dependent on having the right fluidity, which is dependent on having the right type of fats in there. And how this would happen in a daily diet would be ground seeds, seed oils, in particular hemp and flax are really nice for the omega-3 in flax, the perfect balance omega-3, 6 and 9 that we think at the moment in hemp. And if a child has a higher need, it might be that they're atopic, it might be they have eczema, asthma, hay fever, and they might not be quite so good at converting their parent fats into their active anti-inflammatory form. Again, as I said earlier, we have some lovely EPA, DHA algal oils out there which are naturally free from toxicity. Also important are the olive oil, rapeseed oils, and the saturated fats, nuts, nut butters, and coconut oil. So the vegan benefits: less saturated fat, less availability of hydrogenated fat, as when we're talking about protein, and of course reduced obesity risk. Obesity is an overwhelming crisis when anyone is talking about health. When we're talking to health professionals, obesity is a real problem, and the link it has with diabetes and cardiovascular risk. Starchy carbohydrates, we would think this one would be really easy. Let's just feed children everything whole grain, because it's going to have up to 98% of 15 different vitamins and minerals in there. It's going to have all that we need. It's going to have the fibre to help prevent constipation. If a child is very underweight and a very picky eater, we do, however, show caution with filling up too much fibre. And I don't know how many of you have heard that we shouldn't give the under twos whole grains. We need to give them processed white rice and refined things, because we mustn't fill up small tummies with fibre, so they're not full enough to get all the other vitamins and minerals and calories that they need. Unless there is a particular health concern with an individual child, however, that's not really necessary, because all we need to do is add more fat. So give them brown rice. Bear in mind they're going to eat less of it because it's going to be more filling. So put some seeds in it, put some ground nuts or seeds in it, put some olive oil in it, put something which is really high in calories that will mean they get as much calorie out of that as they need. And all children, the government advise, over the age of 2 should be on a whole grain diet. But if we feed them white carbs until they're 2 and then we suddenly turn around and say, right, it's your 2nd birthday, congratulations, happy birthday, and here's the wholemeal bread, rice and pasta, you're probably going to find it quite difficult to then convert that child. So I'd suggest we look at doing that from the beginning. Phytates is the other reason. Now, phytates is an interesting one, and we were discussing this, weren't we, Sandra, that we don't know. Phytates are things that combine to minerals in the gut, so we basically excrete our important minerals for building bones like calcium, magnesium, rather than absorb them. And phytates are also an important antioxidant, so they have the good and they have the potentially not bad, and they are in a large part of the plant-based diets. They're in grains, they're in beans, they're in nuts, they're in seeds. But we don't yet know the answer as to whether phytic acid is a problem or not. There really are different schools of thought on this. But if you're concerned about it, then just the soaking, the drying, the sprouting reduces the phytic acid content anyway and makes this less of a problem. But as I said, we might find that if we do this talk again, hopefully we might be asked back, if we do this talk again next year, we might not even be discussing phytates, because it might be that it's considered not to be an issue. So for a child, at least 4 portions of starchy carb a day. Don't go low carbing children, please. It's not a good diet for them. They need enough carbohydrates for their energy, as well as the glucose in the brain. 1 portion with each main meal and 1 with a snack, and try to encourage at least 3 types a day, so we're not just relying on bread, pasta, wheat basically, but trying all the different carbs bring different nutrients, different flavors, and help enhance children's palates. Vegetables and fruits is really easy. We tend to eat a lot of them in a plant-based diet, so that's less likely to be a problem. And I'm going to hand back to Sandra now, who's just going to finish off our talk and just say a couple of words about calcium-rich foods.
As I said earlier on about milk is often included as one of the recommendations for the children's diet. From the age of 2 years, it's recommended that semi-skim milk is used instead of full-fat milk. Certainly you can get calcium from the plant-based milks, but try and go for those that are fortified with the calcium. Rice milk isn't recommended because of the potential arsenic effect. So we say to make sure you go for the oat-based, soya-based, but to just avoid the rice milk. Again, it's recommended that vitamin D is supplemented to all infants up to the age of 5 years. So that's the vitamin D drops, which I'm sure everybody would have heard of, with vitamin A, C, and D. And then again, this is a listing here of the different foods that contain calcium. So again, you can see that if you include about 3 calcium-rich foods a day, then that child will be meeting the calcium requirements. So as Yvonne was saying, the benefits of the non-dairy sources of calcium are that you straight away reduce the saturated fat. You then get the reduced risk of obesity. And it is quite frightening with the obesity now in children. Again, just to highlight the vitamins and minerals. For iron, it's so important for the children's growth and development. The iron-rich foods are some of those fortified foods. But again, if you have the vitamin C, foods rich in vitamin C, which is your fruits and vegetables in the diet, that enhances iron absorption. With beta-carotene, vitamin A, again to think about having a variety of fruits and vegetables. I often say to patients about having all the colours of the rainbow in the diet, then you'll get that mixture of all those vitamins and minerals. Again, for the nervous system, the green leafy vegetables are very important, and trying to think again of the variety of foods you can have. And vitamin C is abundant in the vegan diet. Yes, where we put their vitamin C supplement as recommended, that's for children up to 5 years of age with the vitamin drops where they get A, C and D. Again, vitamin D we've mentioned. Vitamin E, plentiful in the diet. Vitamin K, again, just some thought with the calcium to make sure you're getting adequate nutrients there. Iodine is one that often people are concerned about. Iodine can be low in lots of diets. So again, having a little bit of the seaweed in the diet. I saw today there's the nori rolls that are here on sale, but you can get a little bit of seaweed in the diet is beneficial and recommended for all diets. And then again from zinc, the whole grain cereals will provide you with plenty of zinc, and the pulses, of course. So Yvonne's put this plan together, which is really nice to show you how you can get, with a typical day where you can get all those nutrients to get a balanced diet. Again, thinking of the nuts, grains and seeds. If you have those over a day, you're going to get that good balance. So for example there, you can see at breakfast, they've got the porridge. In with that, some ground seeds, which will provide you with fat. Then at lunchtime, again, thinking of having some kind of snack there with some fats included. Again, fats are so important for those growing children, for brain, nerve growth, very important there. And also then thinking at tea time, again, you've got the rice and the beans. Again, thinking of a variety of grains there. And then thinking, have I had that variety of fruits and vegetables throughout the day? So in summary, what we want to say, it's so important that you do understand your patient. It's to be respectful of their beliefs and their choices. It's so important that we look at the whole person. And as Yvonne said right at the beginning, to think what we're trying to achieve with that person and respect their beliefs. And to avoid assumptions. I think we all tend to do that and be quite biased at times. So again, to really think what we're trying to do and achieve with that patient we're seeing. And also it's so important to have that evidence, to work with that clinical evidence. Again, there's so much out there that when we think about it, is it evidence-based? And I think as health professionals, people should take a step back. Everybody eats, everybody's got an opinion on diet, so you often get people coming out of the woodwork and saying things quite randomly. And when you go and check back again, is that evidence-based? It's so important. And also to consider the wider beliefs of cultures. I think, Yvonne, you wanted to...
Yeah, I think I think I switched my mic. No, I didn't. I think for me, sort of my final word on this would also be to consider the fact that this isn't just about us working with people who are on plant-based diets, but even more fundamentally than that, it is also looking at actually, this isn't just about those few people that we might have in our clinics or in our practices that are on plant-based diets. This is about the fact that we need to look at all of this learning, look at the true evidence, look at it in an unbiased fashion and consider actually, is it time that we have to consider this information now? Do we now have to consider the evidence that there is on the health benefits of the plant-based diet, making sure that we can give people advice on how to correctly put together a really healthy plant-based diet, because working on this could make a fundamental difference to the health of our children and to the future of all of us. Thank you.